Have you ever experienced redness, itching, a rash around your mouth? You've tried everything, changed everything, but you still don't know why it's there? Let me tell you why this happens. I'm Dr. Anika Goyal, Chief Consultant Dermatologist and Hair Transplant Surgeon at Soul Derma Clinic, New Delhi. Today, I'll tell you all about perioral dermatitis, commonly referred to as a red rash around the mouth. Perioral dermatitis is literally redness or inflammation around the mouth. It can even extend up to the nose and the cheeks. What do you commonly see? You'll see some redness, bumps, pustules, itchiness, dryness, flakiness, a disruption of your skin barrier in that area. The common causes, which you might not have even expected, your toothpaste, especially fluorinated toothpaste, any skincare products that you may be using with exfoliating agents, scrubs. One of the most common causes that I see in my clinic is long-term use of steroids. So it becomes a vicious cycle where you think the skin is irritated, you're prescribed a steroid, and it just keeps getting worse. Makeup should definitely be avoided. So a lot of skincare and makeup products can also aggravate perioral dermatitis or even cause it. How to treat this? So now the first thing is understand what's causing it. You can even speak to your doctor and shortlist all of the possible causes and avoid those, like fluorinated toothpaste, any active skincare ingredients that are exfoliating or irritative to the skin. You can avoid makeup for sure because it becomes again a vicious cycle where you're applying the makeup and it's feeling more flared. Make sure you're using a ceramide-based moisturizer and skip everything else. You could also possibly even skip sunscreen. Some ingredients in sunscreen can aggravate the skin further and irritate it more. So until your skin doesn't heal, just stick to a light moisturizer which is mild, fragrance-free, and paraben-free. Avoid chemical peels, anything harsh on the skin. Definitely avoid bleaching, hair removal, shaving. Very important, anything that's abrasive to the skin will definitely irritate it further. Try to limit your sun exposure as much as possible because this will also lead to pigmentation and further irritation. If you've done all of this and it's still not resolving, please consult a dermatologist. You probably need further guidance or diagnosis. If you found this video helpful, you can share it with your friends, like the video, and subscribe to my channel.